Flatten the curve, flatten the curve, flatten the curve. That's what all you hear. That's what you hear every day on TV. You see this curve. We must flatten the curve. The concept is right. Flatten the curve, slow the spread so the healthcare system can handle it. When they say this, I don't think of a curve. I think of a wave. And the wave is going to break, and the wave is going to break on the hospital system. We're doing everything we can to flatten the curve. I believe we've taken more dramatic actions than any state in the United States. I believe we've had the most effective response of any state in the United States. I don't believe we're going to be able to flatten the curve enough to meet the capacity of the healthcare system. So in this business, plan ahead, plan forward, anticipate what's coming down the road and get ready for it. Expanding the capacity of the healthcare system for a state is virtually impossible. Building a hospital is a very elaborate, extensive, expensive undertaking. Again, we need the federal government to play its role. The federal government has tremendous capacity. I was in the federal government. I was a cabinet secretary. I worked with the military. I worked with the Army Corps of Engineers. They have tremendous capacity. This is what they do. This is what they do. They build airports. They build bridges. They build hospitals. This is exactly what they do. Deploy the Army Corps of Engineers to come work with states to build temporary medical facilities. Get us backup beds. So when the hospital is overwhelmed, we can have some of the people who are in the hospital beds go to a backup medical facility. It makes all the sense in the world. And if you don't do it, you know what is going to happen. You're going to overwhelm the hospitals. You only have 53,000 hospital beds. You only have 3,000 ICU beds. Why? Because our health system is basically a private system. They don't build capacity that they don't need. They don't build extra ICU beds just in case. An intensive care bed is very expensive. They don't build a wing of ICU beds that sit vacant for 10 years on the off chance that there's going to be a public health emergency and you'll need the beds. They don't. It's not economic. It's not their business model. So we don't have them. We have the capacity that people use day in and day out. And that's not just New York. That's every state in the United States. You now have this influx. You can't handle it. You overwhelm the hospitals. You have people on gurneys in hallways. That is what is going to happen now if we do nothing. That is what is going to happen now if we do nothing. And that, my friends, will be a tragedy. We know what lies ahead. Look at the numbers from China, South Korea, and Italy. You don't have to guess. You just have to project. The numbers are on a chart. Our numbers are on a chart. Just extend the current trajectory. Just go dot, 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 and you'll see the numbers rise, and you compare those numbers to our hospital capacity, and it's still math at the end of the day. And it doesn't work. The federal government must do this.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.